Welcome to the Deep Dive, your shortcut to being well-informed quickly. Today, we're taking a deep dive into a topic that feels, well, incredibly urgent and personal to so many of us, the mental health of our young people. Our main source for this conversation is a really vital document, the U.S. Surgeon General's Advisory on Protecting Youth Mental Health from 2021. Our mission today is to unpack what the Surgeon General calls these unprecedented challenges facing today's youth. We want to understand not just that their mental health is suffering, but, why? And maybe most importantly, what actionable recommendations the advisory puts forward for what it terms an all-of-society effort to address this crisis. It's a big picture, definitely, but one with direct implications for, well, every family and community.
Exactly. And it's important to grasp the significance of a Surgeon General's advisory. I mean, this isn't just another report hitting the shelves. These are public statements usually reserved for the most pressing public health issues, the ones demanding immediate national awareness and action. This particular advisory, it's comprehensive because it truly frames mental health as absolutely fundamental to overall health, right on par with physical health. It's essentially called to fundamentally rethink how we support our young people across the board.
That's a really powerful framing. And, to understand the full scope of this challenge, we actually need to look back even before the COVID-19 pandemic, because the concerning trends in youth mental health, well, they were already a rising tide, weren't they? The statistics from 2019, for instance, they're quite stark. You had 1 in 3 high school students, and get this, half of female students reporting persistent feelings of sadness or hopelessness. That was an alarming 40% increase in just a decade from 2009. We also saw a significant rise in youth psychiatric emergency department visits, and a really chilling 57% increase in suicide rates among 10 to 24-year-olds between 2007 and 2018. When you hear those numbers, it really makes you ask, what was driving that pre-pandemic surge?
Yeah, it's clear from the advisory that mental health isn't just about, individual choices or feelings. What we're seeing here is a really complex interplay. It's both biological factors like our genes and brain chemistry, and a whole range of environmental influences. This includes difficult life experiences, discrimination, racism, community violence, and especially something called adverse childhood experiences, or ACEs. ACEs are essentially traumatic events in childhood, like abuse or neglect. And the advisory points out that when children experience these ACEs, it can lead to what's called toxic stress. This isn't just momentary stress. It can cause long-lasting changes in brain development, increasing the risk for mental health conditions and actually other health problems even much later in life.
Wow. So this isn't simply kids these days are sad. It sounds much deeper, like a deeply systemic issue. What were some of the key hypotheses researchers were putting forward before COVID, trying to explain this deeply concerning trend?
Well, researchers proposed a number of factors. Increased digital media use was definitely a big one they were looking at. Intense academic pressure was another. Then there was the issue of limited access to mental health care, which, let's be honest, has always been a challenge. But they also pointed to broader societal stressors, too. Things like income inequality, growing concerns about climate change. These are all significant external pressures impacting young people's well-being.
And within that picture, were certain groups feeling these effects more acutely? Was it hitting everyone the same?
No, absolutely not. The advisory really highlights that these challenges disproportionately affect specific populations. For instance, girls are much more likely to be diagnosed with anxiety or depression. And tragically, Black children under 13 were nearly twice as likely to die by suicide than white children. That's a stark disparity. Plus, socioeconomically disadvantaged youth are 2 to 3 times more likely to develop mental health conditions than their peers with higher socioeconomic status. So yeah, these disparities are a critical part of understanding the crisis.
Right. And then, of course, came COVID-19. The Surgeon General stated it dramatically altered young people's experiences at home, at school, and in the community. I mean, we're talking about massive school disruptions, unprecedented isolation, the just, unfathomable number of deaths, and widespread economic instability. The advisory cites global research showing that symptoms of depression and anxiety actually doubled among youth during the pandemic. Doubled. And in early 2021, emergency department visits for suspected suicide attempts among adolescent girls, they increased by a staggering 51% compared to early 2019. It's really hard to wrap your head around that kind of increase.
It really is. And the pandemic didn't just bring the virus itself, it also brought other intense stressors right to the forefront. We saw the national reckoning over racial injustice, a rise in COVID-related violence against Asian Americans, and, an increasingly polarized public discourse, often fueled by emotionally charged misinformation.
Yeah.
However, it's also important to acknowledge the nuance here. Despite all this, Some measures of distress actually returned to pre-pandemic levels by mid-2020. And, many young people also demonstrated incredible resilience. They adapted. Some even thrived in certain ways. Some reported getting more sleep, maybe spending more quality family time, or experiencing less academic stress and bullying because school structures changed.
That resilience is such a powerful reminder of young people's adaptive capacity. It's important not to forget that. But it's also crucial, as you said, to remember that the pandemic widened those existing disparities. It disproportionately impacted those who were already vulnerable. We're talking about youth with intellectual and developmental disabilities, LGBTQ plus youth, those from immigrant households. The advisory makes it really clear. Youth with multiple risk factors were, and frankly still are, at an even higher risk. So if the problem is this pervasive and the principles for addressing it are clear, where does the advisory suggest we actually start making a difference? What are the practical takeaways for listeners?
Yeah, that's the core message, right?
Yeah.
The advisory really hammers home that supporting youth mental health is not a quick fix for just one person or group. It requires nothing less than an all-of-society effort. That's the phrase they keep using. This means building a foundation for a healthier, more resilient nation where mental health is truly seen as essential. The advisory calls for several overarching principles: recognizing mental health as fundamental, empowering youth and families, ensuring access to high-quality care. Also, strengthening supports in educational and community settings, tackling those economic and social barriers, and, crucially, improving data collection and research.
Okay, so let's unpack some specific actions listeners can maybe think about, starting with what's closest to home. The advisory offers guidance for young people themselves, right?
It does. For young people, the advisory reminds them that mental health challenges are real, they're common, and most importantly, they are treatable. That's key. It encourages reaching out to trusted adults, investing in healthy relationships, both in person and, virtually, finding ways to serve others, which can be really protective. Also, practicing stress management, like maybe limiting news exposure when it feels overwhelming, and being really intentional about social media and technology use. These are proactive steps.
Things they can actually do.
Yeah.
Okay. And for family members and caregivers, the advisory outlines some pretty key roles you can play. What are those?
For families, a big one is role modeling. Taking care of your own mental well-being sends a powerful message. It also stresses fostering strong, safe, stable relationships with your children, encouraging healthy peer connections, and providing a predictable home environment. Structure helps. Crucially, the advisory highlights the need to look out for warning signs of distress and to minimize access to means of self-harm. That specifically includes safely storing firearms and medications, which is a really practical safety measure. It also advises being attentive to children's online activity, not necessarily spying, but asking guiding questions. How much time are you spending? What content are you seeing? How does it make you feel?
Right, opening that dialogue. Okay, so beyond the individual and family level, this really is pitched as a whole-of-society effort. What about the institutions that shape young people's lives every day, like schools?
Schools are absolutely vital in this. The advisory emphasizes creating positive and safe school environments. That could mean implementing strong anti-bullying policies, or even considering things like later school start times, which might align better with adolescent sleep needs. It also calls for expanding social and emotional learning programs, teaching those coping skills training staff to recognize signs of distress, and significantly increasing the school-based mental health workforce. Just for context, the American School Counselor Association recommends one counselor for every 250 students. The national average is, well, it's nowhere near that.
Wow, yeah, that's a huge gap. And for the healthcare system itself, what's the advisory's call to action there?
For healthcare organizations and professionals, the focus is really on prioritizing prevention. That means using trauma-informed care approaches, routinely screening children for mental health challenges and those adverse childhood experiences, the ACEs we talked about. It also means identifying the mental health needs of parents and caregivers, because that profoundly impacts children's well-being, and building culturally competent, multidisciplinary teams that can actually provide tailored, effective services, not a one-size-fits-all approach.
The advisory also points a spotlight on how media and entertainment companies, even journalists like us, can contribute. What's the takeaway there?
Yeah, the emphasis here is squarely on responsible reporting and portrayal. This means avoiding sensationalism, providing context, offering ways for people to find help when discussing difficult topics, and including positive stories too, stories of hope and healing. It's also about normalizing mental health stories, using person-centered language, so not defining people by their diagnosis and adhering to best practices when depicting sensitive topics like suicide. Always ensuring that help is shown as available and effective.
Okay, now, let's talk about the digital world, because the advisory has a lot to say about the complex role of social media, video gaming, and other tech companies. You mentioned teenagers' screen time for non-school activities actually doubled during the pandemic. So what's the call to action for these powerful companies?
This is a really, really crucial area, and the advisory doesn't mince words. It points out the inherent tension, right, between maximizing user engagement, keeping eyes on screens, and safeguarding user health. It calls for these companies to actively design their products with user health and well-being as a priority right from the start at all stages of development. This includes being transparent with their data so independent researchers can actually study the impacts. That's huge. Also, building user-friendly tools that help children engage online in healthy ways, maybe like frictions that prompt users to take breaks, things like that, and actively working to limit exposure to harmful content. The advisory mentions the UK's age-appropriate design code as a potential model, which mandates designing with the child's best interests in mind.
That UK code sounds interesting. So, beyond the tech giants, what about local community organizations? How do they fit into this all-of-society puzzle?
Oh, they're vital. Community organizations play a huge role in educating the public, reducing that persistent stigma, and implementing evidence-based programs right on the ground. They're also critical in addressing the unique needs of at-risk youth, like racial and ethnic minorities or LGBTQ+ youth, and ensuring that the voices of young people and their families are actually heard and centered in designing solutions.
And funders, foundations, employers, they have roles too.
Absolutely. Funders need to make sustained investments in prevention and early intervention, not just crisis response. They can incentivize partnerships across sectors and help scale up things that work. Employers play a part by providing comprehensive, affordable mental health care for employees and their families, implementing policies like paid family leave that reduce stress, and fostering a workplace culture that actually supports mental well-being.
Okay, so that covers a lot of different sectors. Finally, what's the role of government at all levels? Federal, state, local, tribal?
Governments are absolutely crucial, kind of the linchpin in many ways. They need to address those big economic and social barriers that contribute to poor mental health, things like poverty, housing instability. They also need to ensure safe online experiences for children. This could involve requiring tech companies to be more transparent with their data and algorithms, as we discussed. And of course, ensuring affordable mental health coverage for absolutely everyone. Parity is key. Governments also need to strengthen school-based mental health programs, expand telehealth services, which saw a big boom during the pandemic, and really focus on building a diverse mental health workforce that reflects the communities it serves. They're also key in expanding and strengthening suicide prevention and mental health crisis services, like the 988 Suicide and Crisis Lifeline, and improving coordination across all levels to effectively address these needs. And importantly, working to reduce biases, discrimination, and stigma related to mental health within government systems and beyond.
Right. So we've covered a huge amount of ground on what the advisory recommends across all these different areas. But even with all these recommendations, what don't we know? Where do we still need to deepen our understanding about youth mental health? Where's the research frontier?
That's a profoundly important question, and yeah, the advisory dedicates significant attention to it. It really emphasizes the critical need for more and, frankly, better research. This includes improving mental health data collection and integration. We need real-time, disaggregated data broken down by age, gender, race, ethnicity, disability status, geography, you name it, to truly understand trends and target interventions effectively. It also means fostering public-private research partnerships. Imagine leveraging data from sources like wearables or online platforms, ethically of course, to uncover patterns we just can't see with traditional surveys. We definitely need increased investments in basic and clinical research understanding the mechanisms and testing interventions, and a strong prioritization of research with at-risk youth populations, not just on them, to understand disparities and develop effective, culturally relevant interventions. But maybe most critically, there's still so much we don't fully understand about the precise long-term impact of social media and digital technology on youth mental health. It's complicated. We need far more rigorous, independent research, independent from tech companies themselves, to identify truly effective interventions for these digital natives. What kind of policies actually work? What kind of platform design makes a positive difference? What kind of education helps kids navigate this world? That understanding is still very much evolving.
Okay, so this deep dive really shows us the immense scale of the youth mental health challenge. It's undeniable. But crucially, it also offers clear, actionable pathways forward. It truly underscores that phrase, an all of society endeavor. The problem is complex, definitely, but the solutions, while they require systemic change, they do seem within reach if we act together.
Indeed. And if we zoom out to the biggest picture, the advisory points out something really fundamental. Perhaps the most persistent barrier to mental health care isn't just a lack of resources, though that's part of it. It's the profound stigma that's still associated with seeking help. For far too long, mental and emotional health has been hidden, ignored, or seen, unfortunately, as a weakness. So maybe I can leave you, the listener, with this thought. If we as a society collectively commit to reorienting our priorities, to create truly accessible, non-judgmental spaces for seeking and giving assistance in our homes, our schools, our workplaces, our communities, if we genuinely integrate mental wellness into our daily lives and conversations, what kind of healthier, more resilient, and ultimately more fulfilled nation could we build? How will you contribute in your own sphere of influence to normalizing and promoting mental health care in your life and community?